Welcome to The State of Us.
Beyond mainstream cable news and party lines, with a millennial and a boomer, The State of Us pushes past the noise and uncovers all the issues that matter.
Here's your host, Justin T. Weller.
Maggots, rape and yet 5 stars. How U.S. ratings of nursing homes mislead the public. Nursing homes have manipulated the influential star system in ways that have masked deep problems and left them unprepared for COVID-19, according to a feature piece in the New York Times Sunday edition, and it's the basis of today's show. Here's what you need to know. This is kind of the principle of what we're talking about today. Of the more than 3,500 nursing homes that have received a 5-star rating from the government, over 2,400 of them were cited for problems with infection control or patient abuse. Let me put that another way. 68% of 5-star nursing homes have citations for abuse, infections, or both abuse and infections. 68%. How can a 5-star facility, 68% of them, have those kinds of statistics related to it? Well, it's a big topic. It's one that we've got to talk about. Ultimately, it's something that many of us face in our life, whether it's us directly or our loved ones. We have to make decisions about how we're going to care for them. And increasingly, the nation turns to nursing home and assisted living facilities. But can you trust the information that many of us use to make those decisions? It would appear at the very least there's reason to call it into question. That's what we're looking at today. But of course, we could not begin this critical conversation on nursing homes and the healthcare system without
TrueChat senior historian and an educator of more than 30 years. Here is your friendly redneck liberal, Lance Jackson.
Well, the history is that, this used to be done at home by private individuals, that you took care of your own. And then as we see all kinds of the need for people to work outside of the home and 2-income families, then this care had to be done by someone else. And we get this big development of these nursing homes, and then the difference between for-profit nursing homes and nonprofit nursing homes. And so this is going to be an interesting topic today, but for the word of the day, we'll start there and then we'll get into it. Juxtaposition, Juxtaposition, juxtaposition. It's a noun and the fact of two things being seen or placed close together with contrasting effect. In this case, a 5-star rating for nursing homes where, as one resident put it after leaving her facility, she said, "I wouldn't even send my dog there." I don't think she said her dog. She said a dog, to be transparent. I wouldn't even send a dog there.
I wouldn't send anybody's dog there.
Because for some people, their dog is very important to them. Well, of course I wouldn't do that. She said, I wouldn't send a dog there. So, how do you get a 5-star rating and then people wouldn't even send animals there? It's worse than a zoo.
The important thing, I think, is to start here with the back history of, for those that are not familiar, 12 years ago, the U.S. government introduced a powerful new tool to help people make a wrenching decision: which nursing home to choose for loved ones at their most vulnerable. This is from the New York Times article, which is linked at thestateofus.org. Using a simple star rating, 1 being the worst, 5 being the best, the system promised to distill reams of information and transform an emotional process into one based on objective, government-blessed metrics. It sounds like, right, you get 1 star, it's the worst. You get 5 stars, it's the best. This is something we're familiar with online reviews. It sounds like a good principle, right? Because prior to this, all you could do was look at the individual information from nursing homes, all the charts and graphs they want to give you. They'll highlight different information. And even for medical professionals, trying to make reasonable comparisons between homes, incredibly difficult, right? Because you're not being shown the same information, how they're measuring it. I mean, lots of challenging stuff. So the government says, let's simplify this, right? We'll boil it all down, 1 through 5 stars. It'll give you what you need to know simply, and we'll put the information, the same information next to each other so you can see here's why it received the stars it received, right? So it sounds great. The problem has become that as the Times has done this investigation, it's revealed some heart-wrenching stories that are not simply misnomers. The article goes on much later to say, in 2019, health inspectors concluded that a nursing assistant at Rio Vista Home in San Diego had followed a resident who uses a wheelchair to her room from the kitchen where she was getting a late-night sandwich. The employee pushed her onto the bed and raped her, according to the inspection report. Sounds like an isolated incident, but listen, it's not just about the incident itself. The report, and this is from the government, remember, classified the attack as a Category F violation. A Category F violation is a low-level problem that caused potential but not actual harm. That designation helped Rio Vista hold on to its perfect 5-star rating, which it trumpets on its website. The administrator of the facility says this former staff member's actions do not reflect the values we hold at our facility that overall our 5-star rating more accurately reflects. And they're taking measures to ensure something like this never happens again. The article goes on and explains that 40 other 5-star nursing homes, inspectors similarly determined that sexual abuse did not constitute actual harm or put residents in, quote, immediate jeopardy. After a complaint in 2019, for example, inspectors found that a nursing home assistant at Hickory Creek in Madison, Indiana, had barged into the bathroom while a resident was showering and groped her breasts. Hickory Creek kept its 5 stars. Hickory Creek officials didn't respond to a request for comment. And at Manor Care in Boca Raton, Florida, John Schultz, a 57-year-old resident with Alzheimer's, was strangled to death by another resident in 2019. The state coroner ruled it a homicide. The death does not appear in inspection records at all, and the facility still has a 5-star rating. The point is, those numbers that we shared in the beginning, Lance, 68% of nursing homes around the country that have a 5-star rating have citations for abuse, infection, or both abuse and infection violations. And so as we talk about this data, I mean, it sounds awful. It sounds appalling. And we all want to think, right, that this has got to be an isolated incident, that these things couldn't possibly be happening on mass scale. But what the data tells us is it is. And where's the data from? Because I think that's important for people to get, right?
Well, this is from the New York Times, but they, at the end of the article, tell us how they compiled this information so that you understand that it's not hyperbole. But it says the analysis of the STAR system's effectiveness is based in a large part on the data submitted by the Centers for Medicare and Medicaid Services, or CMS, as it is referred to in the article. And the Times used the data that was given to them from January of 2020, before the pandemic upended the industry, temporarily changed data collection practices. It also goes back to include the most recent set of star ratings for each facility and the underlying metrics to see how those ratings have changed over time. The New York Times also examined quarterly ratings and metrics going back to 2015. The analysis also incorporated nursing homes' 2019 payroll data, the daily log of hours worked by nurses and aides and administrators, and Medicare cost reports, the financial statements that facilities submit to the government. The cost reports were used to examine the relationship between profitability and the STAR system. So while that may not be exciting to you, that hopefully shows you that this isn't just, oh, we're just being dramatic, that the New York Times, this is a very long report they did. This is your investigative reporting that a place like the Times can do. And they were very thorough, and they're not just making random accusations to get the headlines, that they have done the research and are basing it on things that were provided to them from the government and from the nursing homes, and that the nursing homes turn into the government. So it's like, folks, this is what they've done. Okay. These are the reports that they've turned in, and yet they've still found a way to keep their ratings, because it's very important what your rating is. Because for the nonprofit nursing homes, if you have 1 or 2 stars, you basically lose money. 3, 4, and 5 stars make money, according to the report. 5-star facilities earn about $2,000 profit per bed. 3 and 4 stars, about $1,000 per bed. 1 and 2-star homes, as we said, they're not even making money. So this star system is very important for these businesses to make this money. So the Times said, okay, we'll use your reporting data to figure out what's going on here and how these star systems are coming up. And then Justin gave you some of the evidence to show that what's going on in some of these 5-star facilities.
And it's a lot of them. And so the point is the data.
2/3, right?
Right.
You basically have a 1 in 3 opportunity to choose a place where your loved one's going to be well taken care of, like the 5-star system says they will.
Right. And that's 5-star facilities. We're not even talking about 4, 3, 2, and 1, right? I mean, and there's plenty of those. We're just talking about supposedly the best of the best. And part of what you mentioned there, right, is the for-profit nursing homes. And we're not saying that it's all for-profit institutions to blame, but interestingly enough, we said 68%, right, of the 5-star facilities have a at least one of those violations or both of those, infection or abuse or both. And today, for-profit companies own about 70% of all U.S.-based nursing home facilities. So it doesn't mean, right, it's not a perfect correlation, and we're not making that leap. We're just saying that's the case, right? And it doesn't mean that they're inherently setting out to do evil, but it's similarly to what we've seen, and I told Lance this before the show, with the for-profit prison system, is when those things are in place, there's lobbying efforts, there's institutional change that takes place, and the individual changes may not seem significant in and of themselves, but over this many-year period, over the time since 2008, this piles up. And we get to where we are now, where 68% of 3-star or 5-star facilities have multiple either infection, abuse, or both violations. So what else do you need to know about this, and what could it possibly mean for where we go from here? How could you trust where to put anybody? There's a lot of questions still to answer, and we're going to try to get each of them taken care of. Keep it here on The State of Us, and we'll be right back.
We are The State of Us. Here's your host, Justin T. Weller.
As we look at what the situation is in U.S.-based nursing homes, it seems bleak. A large percentage, 68% of the best-rated facilities, 68%, have violations for abuse, infections, or both. 68% of 5-star, the very best facilities. And we shared some very hard, I think, to listen to, Lance, stories in the first segment about these 5-star facilities where, for example, an individual was murdered, and it not only did it not affect the star rating, it didn't even show up in the file for that home. That and I think the important thing here too is we want to note, right, one of the biggest issues is understaffing, and that's part of what we're going to talk about next. A lot of these incidents, you're going to say, oh my gosh, who are they letting work at these facilities, right? Well, part of the problem is that the very best staff often leaves these facilities, and the good staff that remains is so under-provided for that they don't have the tools to do their job well. Because we don't want to disparage the people that are trying to work in these facilities. We need them, and they're very important. Being married to somebody that used to work in these types of facilities, the reason he left is because he was uncomfortable with the inadequate staffing, the unprofessionalism of a lot of the management, and not the healthcare management, but the very top level management, right? The business people that are making these decisions about how to do these things. And that's the staffing point.
The problem, in my opinion, comes from the fact that these are for-profit facilities. So therefore, they have investors. They have people who are backing them, and they want to there's pressure to make as much money as possible. So therefore, the number one thing is, with this rating system, you need to get a 5-star rating, because that's going to allow you to charge more money and make sure that your occupancy rate is at capacity most of the time, because that's how you're going to make the most money. And so you're not putting necessarily patient care as the number one. Now, the system, the 5-star rating system, would say that you are, but then there are reporting inadequacies. There are places that you can report. And as you mentioned, staffing, one point in the article was one of these nursing homes, and then others began to follow. One way they could make the time spent with the people in the nursing home greater with the patients is, well, we're going to count the administrators' hours towards the number of hours that we provide contact with the patients. So the person who's in there, who's necessary for doing the payroll for the facility or, accounts receivable, the people working in the office who are important to the running of the facility, well, their hours were also reported in the staffing reports to make it seem like patients were getting 2 to 3 times the amount of personal care that they actually were. They were actually being seen maybe, on average, let's say 15 minutes a day. But when you averaged in the administrator's time spent running the nursing home, the for-profit facility, then patient contact with personnel went up to 45 minutes a day. So, and those are just random numbers. The article is more specific, but that's what they did. They manipulated the numbers. And my point here is that it almost forces them to, because if you have this rating and you're trying to make money, then that's what you have to do to make the most money. Obviously, when you're talking about dealing with human beings, my big question is that what our focus should be? Our focus is on how to make money, not how well we're taking care of your loved one or my loved one, or in our futures, me or you. Is that the kind of situation, the kind of system that you want to go into, is where the driving force isn't the kind of care you're going to get, but how much money the people who have invested in this nursing home are going to get on their from their quarterly report.
The other thing is some of the safeguards that are in place, like audits, are so rare that they can't do any good. The Times found that from 2017 to 2019, health inspectors wrote up 5,700 nursing homes, which is more than 1 out of every 3 in the country, for misreporting data about residents' well-being. That included nearly 800 homes with top ratings. Some facilities didn't tell the government about certain medications that they were giving residents. Others didn't disclose when residents took serious falls or developed bed sores. Even when inspectors discovered such misreporting, they didn't conduct more detailed audits of all the data that the homes submitted to CMS. And so the point here is that you have some things in place like audits, right, that should protect people, but they don't. So what about then the other safeguard that's in place, right, are the not so surprise inspections, which are supposed to be surprises, by the way, if you didn't pick up on that. There are supposed to be surprise inspections at these facilities. In theory, they're supposed to occur at any time without notice. But the Times found that in 2019, about 70% of nursing homes increased their staff on the days that inspectors visited, compared with their typical staffing levels on that day of any other week. On average, the homes added 25 hours of staff time, a roughly 8% increase, to their rosters on the day of the inspection. For more than 800 facilities, inspection day was the best staffed day of the entire year. The odds of that happening randomly are virtually zero, suggesting that many homes are able to anticipate and plan their inspection days, which defeats the whole purpose of a surprise inspection. So the audits, which are writing up more than a third of the country's homes in 2019 for misreporting data, and the surprise visits, the audits aren't followed up on with detailed audits about other things happening. There are no repercussions, evidently, for the said audits. And then the surprise inspections aren't really surprises. And the homes roll out the red carpet and put on the horse and pony show for when the inspectors show up. So the inspectors come and it's like, yeah, it looks pretty good. Yeah, you got lots of people here, just like you said you do. Everything seems fine, And then, of course, the next day, all those people are gone and the residents aren't getting that kind of care again. The bottom line, I think, Lance, the thing that people need to take away, right, from all this information that we're sharing, because we can go on, there's so much here to break down and dissect about all of the very bad things that have taken place at these homes and are taking place, keep in mind, right now, today, as we're talking to you, is that the 5-star system, while great in principle, has unfortunately been terrible in execution and has further increased this cycle of, you were mentioning the difference in profitability. I was looking at it. 5-star facilities earn about $2,000 a bed in profit, folks, $2,000 per bed, right? For 5-star facilities versus only $1,000 per bed for 3 or 4-star facilities. And if you have 2 or 1 stars, generally those are non-profitable institutions. Not that they don't want to make a profit, but they're not actually turning a profit if they have 2 or 1 stars. So we've created a system where you're encouraged to get 5 stars, which makes sense. But for 70% of the nation's homes, which are for-profit institutions, it often means doing whatever you can do in order to maintain 5 stars, even if you shouldn't have 5 stars.
And the reason we're talking about this, folks, is because if we don't get the word out and you don't understand this, you're going to do what millions of Americans do every year when you're looking at what you're going to do with mom and dad or with grandma, or maybe you're an older American like me, what you're going to do with yourself. And you're going to read these rating systems and you're going to make your decision based on that. And then you're going to think you've put them in a good place. And even if you visit them, a couple of times a week, it's going to take a while for you to find out what's going on. And then that's the kind of care you have. So we need to advocate now for, it sounds like, a different system or a different way that we're going to do this, because otherwise, as we've said before, it's just a shot in the dark as to what we're doing here. And we're talking about, there's another anecdotal piece here where this perfectly healthy lady went in for surgery, and because of her Medicaid program, she had to be released from the hospital and went to a step-down unit, one of these for-profit places. And within a month, she was dead because she wasn't taken care of well. It was just a surgery where they said, well, you can't be in the hospital anymore because that's too expensive. So we're going to put you here. And they put her on some drugs that she shouldn't have been on. And before anybody in her family found out what was the matter and got rushed to the hospital, it was so late. She was dead within a month of entering this nursing home facility that was being used as a step-down unit from a surgery that she had. And she was a perfectly healthy person when she went in. That's what we're talking about here. Not trying to scare anybody, but this is a problem. As our nation is aging and getting older, what are we going to do to fix this? This is a problem. Now we need to fix it.
Story here before we go into the third segment, similar to the one that Lance shared, but this is actually a different one. The reason I want to share this is it involves Brookdale, which I'm sure many individuals listening have heard of because it's one of the highly rated institutions across the United States. It's a chain of homes. Carrie Johnson, 75, had a spinal fusion surgery, and a raw incision snaked up her back, and it needed to be cleaned regularly to prevent infection. She couldn't control her bowels. According to the CMS website, Miss Johnson found a nursing home, Brookdale Richmond Place, where she could recuperate. Part of the country's largest chain of senior living communities. It was a short drive from her house and the only facility with a 5-star rating. We thought it meant that I'd be safe, Miss Johnson said, but that's not what it meant. At the time, in October of 2017, Brookdale was operating with a skeleton crew, according to 6 current and former employees and court documents filed in a lawsuit. Overwhelmed employees at the 120-bed facility would wake some residents as early as 3:30 a.m. to get them dressed for breakfast, and then would put the residents back into bed to wait the hours until mealtime, the lawsuit alleges. More than a week passed before Miss Johnson was first given a shower, her medical records show. Her surgical wound was not treated. Not Occasionally, it was not treated. No one came when she rang her call bell for help going to the toilet, so she sat for hours in her own urine and feces. At one point, Miss Johnson said a passing maintenance man changed her diaper. On at least 3 days in her first month there, no one brought her pain medication. Some days, there were no nurses on the floor tending to patients, according to the current and former employees and depositions in the pending lawsuit. Nurses spent an average of less than 30 minutes a day per patient. Brookdale, however, told Medicare that each resident received an average of 75 minutes of daily care. The home arrived at that number by including, as Lance had mentioned before, nurses who were stationed at Brookdale's corporate headquarters in Tennessee, some 200 miles away, according to depositions and the employees. Absent the inflated staffing numbers, Brookdale's rating would most likely have fallen to 1 or 2 stars. Jessica Crutchfield, a nursing assistant who worked at the Brookdale home while Miss Johnson was there, said in a deposition last year that her supervisors told her to falsify residents' medical records to make it look like they received more care than they did. When she refused, she was fired. This is what we're talking about. The for-profit institution creates environments where the people, the loved ones that we put there, are not safe. One of the generally best regarded institutions in the nation is engaging, allegedly, in these types of practices, but according to their own self-reported data, much of it's right there in the medical records of this poor woman who clearly needed a lot more care than she was getting. So what do we do about this? How can you possibly make a decision knowing this information? We want to hear from you. I hope that folks out there are as frustrated and appalled and upset by this as Lance and I are, but we'd like to hear your thoughts. Send us an email, podcast@thestateofus.org, podcast@thestateofus.org. We've got more to come. Keep it here on The State of Us, and we'll be right back.
We are The State of Us. Here's your host, Justin T. Weller.
I think it'd be easy, Lance, for people to listen to today's episode, the first 2 segments, and say, oh my gosh, how could I ever make a decision now about where to put a loved one? And I think we'd be right there with you on learning all of this information. For many of us, hopefully removes any idea that we could trust the star rating system to accurately give us a true picture of the quality of care that individuals are going to receive at these facilities. And so you and I talked some, Lance, before the show about the larger issues at play here, right? Because today we can take away from this, if nothing else, we want people to take away, don't blindly trust the star system. In fact, probably don't trust it at all. Unfortunately, your best bet might be to examine the specific data from these homes, which is, again, available in detail at the CMS website, but you can't just compare the star ratings and expect to get an accurate picture of the level of care you're going to receive.
Well, like you said, they have major problems or major incidents that take place in their facility, and they're not even reported. So if you do your due diligence and looking through all the reports, and what most of us don't take the time to do that. But if we were to reread all the reports, and it's not even listed in their reports.
Well, and then when it is listed, there's no reprimands for it.
And there are no specifics, and you don't know really what it was. And It's listed as, oh, well, it really didn't cause a problem.
Right. Yeah. The rape didn't cause pain or suffering. The death, that didn't pose any real harm. It was only potential harm to patients. But that's not hyperbole.
But again, no, that's taken from the reports that the Times presented. So, those are just the facts. So even if you, like I said, are doing your job and reading about it and spending your evenings and weekends at home trying to find the best place, you're not necessarily going to be given the information in such a manner to where you can make the best decision.
I wrote down when you and I were talking, there are people in homes that shouldn't be. And that's a twofold component, right? Part of what we can see from this there are people that are too ill that are being sent to facilities that are not equipped to take care of these individuals.
Because their insurance won't pay for any more hospital care or for whatever reason.
Right.
So we'll push them off over here.
Yes.
Exactly.
And again, anecdotal evidence, but I can tell you from having a spouse that's in this line of work that worked at assisted care facilities. I mean, this is nursing homes we're talking about. We're not even getting into the assisted living community, which is a whole other thing. The number of people that should be in nursing homes that are actually in assisted living facilities. And then you get into, well, how many people are in nursing homes that need to be in the hospital?
So there's a systemic problem is what you're saying from hospitals to assisted living to nursing homes, right?
There is clearly a systemic issue there with people that need a level of care being in the wrong place, where even though the staff may want to give them the right care, they're not qualified
or equipped.
Yeah. Exactly.
Gotcha.
And then the other side of that, because this is a two-sided thing. There are people in homes that shouldn't be. There's also a lot of people in facilities that don't need that type of care, that are, and I know it sounds like there's no good care available, but at the homes where there is good care, there are people that don't need, for example, to be visited by a nurse every day. They may need to be visited by a healthcare professional of some kind every day, but not necessarily a nurse, right? And they may not even need somebody to stop in every day, but they are taking up room and space in these facilities, and they require staff, right, at certain levels. At-home care is often similarly priced or cheaper when compared to nursing homes. The USA national private room daily average is $290, compared with, and it ranges from $180 to $400 a day. Okay, so the very top end's $400, the bottom end's $180. In-home 24-hour healthcare, okay, ranges from $15 to $25 an hour, or $150 to $350 a day. So the bottom end is less and the top end is less than private room care at a facility. Annual comparison, $105,000 on average, or $146,000 at the top end for the very best facilities for private rooms at nursing homes. Home health care, the very best top of the line care, $127,000 a year. So even on the low end, you're saving almost $20,000 a year in the care component by being at home. And on the low end, $54,000 a year, half of what the national average at $105,000 is for those rooms. So generally the thinking would be, I should be able to get better or similar care for the same or less money by being at home. And I would think the happiness would be higher too. What do you make of, I mean,
very, very quickly, because we're running out of time, but the point that we were talking about before the show was that this is a whole dynamic change in our society. That I remember, my mom talking about her grandparents being taken care of at home. But then my grandfather was the only one that went to work, and grandma stayed home and took care of them along with the children. And as you said, we've changed. And when you talk about this change taking place, it's also because people have decided that they need to earn two incomes. And in many cases, it's not decided, but they need to earn two incomes to pay the bills because wages have not kept up with inflation over the last 50 years. And we've done shows about that. So that's not to get into that. But then it's forced us into this dynamic. And what you've brought up is a solution that instead of paying through Medicaid or Medicare all of these bills to for-profit nursing homes, we could offer this to families and say, you know what? If you have somebody who stays home and takes care of your loved one, you can get $50,000, $60,000 a year, which would be the low-end cost of what the government insurance is paying for these high-end facilities. And then instead of having to make that decision on when to go see your loved ones in the nursing home, or if you can, and I hate to say it this way, but for so many people, find time to go there, they would be in the home. And so therefore your kids could interact with them. You could, their grandchildren, aunts and uncles, and it would be much more of a family setting, which you would think would make the individual happier. And I said this to you, maybe it would change our attitudes towards the elderly, because what the nursing homes have done, didn't mean to do this, but to me, it's almost like, well, we've gotten rid of that segment of our society. We've put them in these places and they're out of sight, out of mind. And you say, oh no, I always go see my grandpa, every Sunday afternoon. Okay, but if he lived in your home with you, or, we have that idea of they live down the street from you, and so you could see them on a daily basis on your way to and from school, or every morning you could say, bye, Grandpa, we'll see you later, and you come home from school, hey, Grandpa, I had a good day at school. How much would that do for you and your attitude towards the elderly? And how much would it do for the enjoyment of life for the elderly? And all of this can be done with money that we're already paying. And to me, that's the bottom line, is we're not saying that this can be done. We have to change everything. We're just going to we're going to divert the money. We're going to divert the money to families to take care of their own, rather than giving the money to for-profit facilities that have strangers taking care of our family members. And again, we're not going to force anybody to do it. This could be an option, right? So it's not like, oh, I don't want to do that, or I don't have the capability to do that. Okay, then you can still have these for-profit nursing homes, but just give people the option. This makes total sense to me. So we're out of time almost, but that's where I am with this.
Yep. Well, I think a key to what you've laid out for folks, what we've explained in the cost benefit scenario, not just the quality of care, which I hope would be the first thing that we want to talk about, but we have to talk about cost because it's a real component, is that this is based on family being willing to allow a loved one to live with them and have that in-home care come in. Because the cost does change if you're talking about them living completely on their own in their own home with their own utilities and all of that. So I do think that that's an important caveat, and that requires that mindset I think that Lance talked about. And it's not a one size fits all solution, because this is a complex issue and there's a lot of complex answers, like to wages. What are we doing about childcare? All these things that come into play that have an impact on this that we have to talk about. Hopefully what we've done today, though, is at least bring to light that unfortunately you cannot trust this 5-star system. I think it is sincerely Lance and I's opinion that you must find a way other than that system to make these decisions, because it will not provide you the information that you think it will. It is not safe to rely simply on that information. We want to know your thoughts. Email us, podcast@thestateofus.org, podcast@thestateofus.org. Send us an email, please. That's part of what we're doing here, right, Lance?
That's correct. Our mission here at True Chat is to educate people by providing honest, open, and respectful conversations. And I think we've done that today. Again, this is just, we're laying it out there for you folks. We got to make decisions and where we're going to go from here. If you've enjoyed today's show, or you have, you want to get others involved with us, because that's how we'll make these changes, let them know they can listen to the show as a podcast on Spotify, Overcast, Stitcher, Apple Podcast, and everywhere podcasts are found.
The State of Us is a syndicated radio program and a podcast. You can find us Tuesdays and Thursdays by 4 a.m. East as a podcast, and on the weekends and select talk markets as a syndicated radio program. Check out our website, thestateofus.org, for all the ways to tune in. For The State of Us on True Chat in Urbana, Ohio, I'm Justin T. Weller.
I'm Lance Jackson.
Special thanks to our producer, Bradley Butch, and thank you all, our audience, for tuning in. We'll see you next time. Be the change. Be sure to check out our website, thestateofus.org, for books, articles, and all the ways to tune in. thestateofus.org.